Welcome to Module 8 lecture, looking at work in the workplace. So how the type of work one does, or where you work, or the characteristic of the workplace, how these things may work to impact health and mental health. There's so many benefits associated with employment. As you know, we've covered employment as an important factor related to health and mental health in previous lectures. The many benefits including having consistent income is associated with high status, right? Your social status and within your community can be influenced by your employment level of employment, prestige, feeling. Having high self-worth is associated with employment. Can be associated with employment, although self-worth is associated with other factors as well. Employment facilitate access to resources that are shown to impact health outcome, right? Being employed means that your employer also support like health insurance, meaning that a portion of your pay goes toward life insurance, but it's also supported by your employer. Being employed is associated with food security and also living in a safe place, a healthy environment where if certain neighborhoods tend to have better educational system. So all of these things I've mentioned before in terms of how employment impacts so many things related to health, even mental health outcome, is pretty clear, given the access that it provides to so many things. While being employed, it has shown to be related to so many health-related outcomes, it is important that you are aware that the type of work that you do in the workplace environment can also impact your health. So let's look at some of the many things that have been in the media for a while in terms of veterans' health. So folks who were working at Camp Lejeune between 1953 and 1987 were exposed to contaminated water that increased the risk of certain illnesses, and these are the conditions that are related to that type of exposure. So increased risk for adult leukemia, bladder cancer, multiple myeloma, and Parkinson's disease. Accordingly, the VA, Departments of Veterans Health, have developed programs who are trying to address the impact, long-term impact of folks having been exposed to this condition, consuming or drinking contaminated water. So the work that you do where you work can increase your risk for various chronic conditions. Another important thing you may have seen in the news is how work or the workplace can impact health, but because the type of work you did in the VA determine whether or not you were, for example, exposed to orange agent. So orange agent is a type of pesticides that is used in agriculture, and it has been shown to impact health in a way that increases risk for bladder cancer, type 2 diabetes, hypothyroidism. So all of these conditions can impact your life, can have significant adversely impact your life. So the workplace and the type of work that you do in the workplace can be hazardous to your health. Accordingly, it can be a determinant of health. Another military-related exposure is asbestos. Depending on the work that you did in your time during the military, a lot of veterans have been exposed to asbestos. and related conditions to that exposure include ovarian cancer, lung cancer. So the workplace is really, hence the reason there are a lot of laws have been enacted to make sure that hazardous work conditions are prevented. But nevertheless, and these things are not as prevalent as they are 30 years ago, but nevertheless they still exist, and health conditions within conditions within the workplace and the type of work I have to do still can pose some risk for your for various health outcomes. So employment status, whether you are high level of employment or low level of employment, has shown to predict health outcome. And the module lectures show different cases of how certain employment level is associated with different health outcomes. So occupation and health. So the type of work that you do, as we mentioned before, can increase your risk for various chronic conditions. And we see that with various exposures for veterans based on the previous slides. So a level of occupation, whether or not you have your occupation is considered high level of occupation or low level of occupation, these type of occupations have different health outcomes. So several studies have shown that, including that with Cutler et al. 2008, that Americans with high level of occupation tend to have lower likelihood of having hypertension and early death, early mortality. Manual workers in the U.S. have greater likelihood of dying, 50% more likely to die in any given year in comparison to those who have professional or executive type of occupations. In the UK, employment also highest employment status is also shown to be related with less mortality risk, and more specifically, folks who were in the hierarchy of employment, highest level of employment, show that they were 70% less likely to die across a 21 year period in comparison to those who were in the lowest status. U.S. Manual laborers have reported lower health, physical health, than those who are in professional occupation. For manual workers, they tend to show rapid decline in their health as they age. A study with Dutch participants show that male and manual workers versus non-manual workers had differential health outcome, with men who were not manual workers indicating showing better health. And we know manual workers tend to be very labor extensive. Construction work are examples of that. So it takes a lot of physical energy to complete this work day in and day out in comparison to someone who's working an office job. Not that I'm saying that office jobs are not can be challenging, but the physical toll of somebody who's working construction versus someone who's a secretary in an office, it's quite different. So there has been some proposed theories in trying to explain the relationship with occupation level and differential health outcomes. So one theory is that it's not just the type of employment, whether you're low or high status, that really is impacting health, but more so it is that folks who are in lowest level of employment, could be various blue collar jobs, tend to compare themselves with their high achieving counterparts, higher achieving, higher status counterpart. And in turn, that increased psychological stress, which leads to the psychological stress stem from perceived low achievement, financial barriers, and sense of hopelessness, of helplessness. Meaning, sense of hopelessness that things will never change. You're kind of stuck in this low level job. Sense of helplessness. There's nothing you can really do to help yourself get out of it. Another theoretical explanation between, trying to explain occupation types and outcome is that the physical demands of certain job and the characteristic of the job explain the disparities we see in health between higher status and lower status. And I kind of alluded to that earlier, that if you're in a construction worker versus you are working at an office, the physical demands tend to be vastly different, with the construction workers have more physical demands to complete their work. Highest employment is associated with more creative jobs. More creative jobs is associated with better health. And of course, those who tend to have more creative jobs tend to have more advanced education. Another sort of theory that's being proposed to explain the nature of the relationship between types of employment and health outcome is the third factors theory. Basically, this approach is that there are third factors that might explain the nature of the relationship between employment and health. So therefore, employment is not directly impacting health. That relationship, it might be moderated by a third factor. So one of those third factors could be level of education. So education has shown to be related to health and health outcomes, health and mental health outcomes. Educational levels between those who are manual laborers versus those who are non-manual laborers tend to be vastly different. So folks who are high employment status, who are in managerial positions, or who have professional positions more so, tend to have more advanced education in comparison to those who are manual laborers. Another factor, one of the third factors, is that may explain the relationship between employment and health outcome is also job selection. How folks go about choosing their job may also impact the nature of the relationship that you're seeing about employment. So understanding that folks may choose their job based on her health status and mortality risk. And as I mentioned before, is that in previous lecture, is that some immigrant populations stayed in positions where they are being economically exploited because of their legal status. Similarly, if you suffer from certain chronic condition that may also limit you to a certain type of jobs, you may feel like, okay, you have to choose this particular job because of your health status. Also, certain job increases risk for early mortality. For example, unfortunately, being a police officer comes with increased risk. So somebody may not choose that job, even though it might be available to them, based on the risk for mortality. Or even your health status. You may choose your health status and the likelihood of premature mortality. You may not want to invest in a certain type of employment because of your health status. So this is the explanation in terms of job selection. Also that people with good health, according to Delir and Levy 2004, people with good health prospect are selected in two types of occupations, which kind of make sense based on your health, you being selected or selecting yourself into certain type of occupations makes sense. So not only that your occupation level or your level of employment versus if you're in high employment level or lowest employment level, but the type of shift work that your work schedule can influence health and mental health. A lot of studies around shift work have been done because of the adverse effect it has shown to have on overall functioning. So shift work focuses specifically on overnight to early morning shifts or rotating shifts with rotating shifts, meaning that you have normal schedules of 9 to 5 one day, the next day you might be doing the overnight to early morning shifts. These type of work schedules have shown to have really adverse effects on health outcome. One of the problems that we see with rotating shift is that it's significant chronic sleep issues. This is because your circadian rhythm, which is this internal clock that really control our wakefulness and when we are ready to go to sleep, is impacted when our work schedule is vastly different, or when we have a work schedule that is not consistent with your circadian rhythm. And the circadian rhythm tends to deal with, how, when it's light during the day versus when it's dark during the nighttime. Because during the nighttime, as it's getting dark, the release of serotonin, which is associated with increased sleep, is being released, versus it's not likely to be released during the day, during the daylight. So chronic sleep problems, inability to, difficulty to sleep or remain asleep are some of the sleep-related problems we see with folks who are doing overnight shift or rotating shifts. These type of work schedules also have shown to increase your risk for chronic conditions, for example, obesity and cardiovascular diseases. In terms of obesity, it's quite possible consuming certain type of food during the night, feeling stress, might be associated with increased weight gain. And of course, increased weight gain is also associated with cardiovascular diseases. Also, that these type of work schedules is associated with increased stress. Increased stress is one of the risk factors for cardiovascular diseases. It's also that these increased stress also have been shown to impact the family structure. So folks who work these shifts tend to report family problems or marital problems. Additionally, in terms of health outcome, these shifts, people within these shifts tend to have impaired alertness with increased likelihood of accidents within the workplace. Work-related benefits shown to affect your health. So the type of benefits you have available to you in your work and your job is associated with health outcome. For example, paternity leave is associated with health. So several studies, including Wintergarten and Bracey 1995, have shown that job paid benefits, maternity leave, have differential health outcomes for families. For example, having extra paid maternity leave is associated with decreased rates of infant mortality by 0.5 death for 1,000 live births. So the mortality risk for infants is impacted by the job benefits of their parents. Parental leave, and parental leave can also include maternity leave, but it can also include other type of leaves related to the family. So several studies looking at focusing on European populations show that a 10-week job supported parental leave is related to reduction of infant mortality by 1 to 2%. 20-week as the job supported parental leave is associated with greater reductions of mortality, infant mortality rates. So it decreased by 2 to 3%. 30-week period increase in reduction, show a significant reduction by 3 to 4%. In the U.S., the past, according to Montoya Williams et al., I believe 2020, there is a 12% decrease in postnatal mortality, and this was following the first following the enactment of the first family paid leave, which was in California in 2004. So, work-related benefits, the benefits that you have available in your work, they can impact health and impact the family structure, including infant mortality rather. So working in academia can be hazardous to your health. You may have heard of this case. It happened, I believe, close to 10 years ago, a little bit over that. This is a professor who was denied tenure and went into a faculty meeting and killed 3 of her colleagues because she was denied tenure for a certain time. There's a lot of stress that comes with a career in academia, particularly being a professor, because tenure comes with a lot of accolades. It comes with a lot of status, a lot of various benefits, and the process of getting tenure is very stress-provoking. It's very stress-provoking because you have to show that you've achieved a list of things, and being denied tenure is like death for a lot of folks, not physical death. So accordingly, we see that in academia, the type of work-related stress can be hazardous to one's health. Certainly in this case, unfortunately, it was hazardous to the health of this woman's colleague. Dr. Amy Bishop was a Harvard-trained doctor that led to, that murdered 3 of her colleagues because of stress. And of course, I'm not saying that work-related stress is associated with murder in the workplace. Absolutely not. But there have been cases with work-related stress coupled with personality characteristic that lead to these type of harmful behavior. Hence the reason a lot of studies have been conducted around work-related stress within academia. So Brana et al., which is one of the articles you read for this module, looked at work-related stress among academics, among professors from tenure track to associate professor. These were some part of their samples. So they looked at stressors like role overload measures, vocational strain discrimination within academia, and I think that may be relevant for any type of jobs. Feeling like you are doing way too much than what's expected or what you thought you were going to do is going to be associated with greater stress. So understanding that the individuals has much more, their time has much more demands than expected, can impact stress, because it can impact your ability to perform, to do what you need to do. So an example of how these work stresses were measured in this study is role overload measure, vocational strain, and these are some examples of these items of how this was measured. Discrimination, being discriminated based on your gender, race, ethnicity, or class. And why these measures are important, because these are factors that tend to be reported around work-related stress, right? Feeling like you being asked to do so much, feeling like you, because of the demands, the overload, you dread going to work. When you are at work, it's very hard to concentrate because of work-related stress. And of course, discrimination based on your gender, feeling like that even though you're putting in the effort, yet you're not being given the same opportunities, or your career trajectory is very dissimilar to those who are of a different race or different gender. These are some of the common factors associated with work-related stress. Work-related stress, also life events, that's part of assessing different factors that might be underlying how people deal or respond to work-related stress, as well as coping strategies. So if you have in one of your articles, I believe it mentions spillover. So if you have difficulties within your family, that might impact, that might be a really important source-related stressor that also can influence your work. That also having difficulties with your colleague can also impact your work-related stress, and also there could be a spillover even to your family. Problems with money, independent on whether or not you have work with your family, can also impact how you perform at work, how you deal with stress within the workplace. Coping strategies, as we know, if a situation is very stressful, the ability to cope, the ability to engage in activities that help you to take care of your physical health and mental health can really help, can be protective factors against the level of impact the stress has on you. You may not be able to, decrease the level of stress. However, how you cope with it by engaging in coping strategies may lessen its effect on your health, your physical health and mental health. So they also assess for self-care. One example of how this was measured is you get your regular physical checkup, and also social support. Social support is essential in managing stress and managing and coping with difficult situations, including work-related stress. So the results show that perceived discrimination, vocational strain, work overload, and life events were associated with physical symptoms. However, self-care moderated those relationships, which means the nature of the relationship between these workplace stressors, including perceived discrimination, vocational strain, and how it impact reported physical symptoms. That the nature of the relationship was moderated with self-care. So self-care moderate that relationship. Moreover, vocational strain and life events predicted depression symptoms, with self-care and social support moderating those relationships. Self-care, as I mentioned, in social support have been shown to be important factors that have shown how people are able to cope when faced with various stressors and remain resilient in those situations. So resilience is not that people cope, people shouldn't be told to power through it. Rather, there are certain resources you can use to help ameliorate the impact of stress on you physically and mentally. A study by Sleff and colleagues found that workplace stress was associated with physical assault, bullying, and harassment. Why is this an important social determinants of health? Because it impacts how we function mentally and physically. And chronic stress, I have shown in previous lectures, has physiological impact, which negatively influence how various processes, biological processes in our body work to function in terms of health and physical health. Because of chronic stress, that increases your likelihood of developing various chronic conditions, and chronic conditions in turn are associated with premature mortality. So overall in this lecture, we cover that employment types, type of employment you have, type of work you do, can be associated, increase your risk for developing chronic conditions for certain groups and dying early. Shift work, the type of shift you work, can also negatively impact your health. Level of employment or occupation has different health outcomes, with high level employment showing to be a protective factor. Job supported benefits such as maternity leave is linked to better health outcomes as it relates to infant health and mortality. Workplace stress is associated with poor in physical health. So based on this lecture and of course the materials other materials you've been exposed to, we show that the work and the type of work, shift of work, overall work, and workplace can be important determinants of health. All right. Here are some references, more references on this topic, and I will see you next time. Bye.